If you're over 70 and trying to get your blood pressure as low as possible, you need to hear this very carefully, because sometimes the biggest danger is not blood pressure that is too high, but blood pressure that has been lowered too much. Many older adults feel reassured when they see 120/80 on the monitor. The doctor is happy, the family is happy, they believe they are doing everything right. But what very few people are told is that after age 70, and especially after age 75, blood pressure that is too low can increase the risk of dizziness, falls, fainting, kidney problems, and even the gradual loss of independence. Some studies in older adults have found that people with very low blood pressure who take multiple blood pressure medications have a much higher risk of serious falls and hospitalizations. And even more frightening, many people do not realize there is a problem until they fall in the bathroom, trip on the stairs, or suddenly feel the whole room spinning just because they stood up too quickly. In the next few minutes, I'm going to show you what blood pressure range is often safer after your 60s, 70s, and 80s, the signs that your blood pressure medication may be too strong, and a simple test you can do at home in just a few minutes that may help you spot your fall risk before it's too late. Before we begin, leave your age in the comments below, and if you have ever felt dizzy when getting out of bed, standing up from a chair, or rising from the dinner table, add the word dizzy. I want to see how many people are dealing with this sign without realizing it may be more than just normal aging. Because sometimes standing up at the wrong moment can change your entire life. Many older adults believe something that sounds completely true. The lower your blood pressure, the better. They think that the closer the number gets to 120/80, the safer they are. But after age 70, the body no longer works the same way it did at 40 or 50. Think of your circulatory system like a plumbing system that has been working for decades. When you're younger, your arteries are soft, flexible, and blood flows easily. But over time, blood vessels become stiffer, narrower, and lose some of their natural elasticity. That means older adults often need slightly higher blood pressure to push enough blood to the brain, heart, and kidneys. That is why a 45-year-old with a blood pressure of 120/80 may feel perfectly fine, while an 80-year-old with that exact same reading may feel tired, weak in the legs, lightheaded, or low on energy. And it is not just the blood vessels that change. After age 70, the liver and kidneys process medications more slowly too. A blood pressure pill that worked well a few years ago may suddenly become too strong. The medication stays in the body longer, its effects last longer, and sometimes blood pressure gets pushed too low without the person even realizing it. The dangerous part is that many people think signs like fatigue, sleepiness, brain fog, or dizziness are just part of getting older. They live with it for months or even years. But in many cases, those symptoms may be a sign that their blood pressure is lower than what their body truly needs. One study found that in older adults who were more frail, walked more slowly, or had several health conditions, pushing blood pressure too low did not help them live longer. In fact, it may have increased the risk of falls, hospitalization, and loss of independence. That is why, after age 70, the goal is no longer to get your blood pressure as low as possible. The goal is to find the blood pressure range that is right for your body. A 77-year-old man named John from Michigan had his blood pressure medication increased because his readings were usually around 145/85. John used to work in construction. He still walked every morning and was doing a good job taking care of himself. After a few months on the new medication, his blood pressure dropped to around 122/76. On paper, everything looked perfect, but what no one noticed was that John started feeling slightly dizzy every time he got up from the couch. In the mornings, he often had to sit on the edge of the bed for a few seconds before standing up. Some days, while standing in the kitchen, his vision would go dark for a few seconds before returning to normal. He assumed it was just part of getting older, so he never mentioned it to anyone. One night, John woke up to use the bathroom and stood up too quickly. Within seconds, he lost his balance and fell to the floor. The fall left him with a broken hip. After that came surgery, weeks in the hospital, and several more months of rehabilitation. But the hardest part was that he no longer felt confident living alone the way he used to. This is something many older adults are never warned about. They often believe the biggest danger of high blood pressure is a heart attack or stroke, and that is true. But for people over 75, blood pressure that has been lowered too much can be dangerous in a different way. It does not cause an immediate crisis like a heart attack. Instead, it slowly makes people weaker, more dizzy, less steady on their feet, and more likely to fall. According to the Centers for Disease Control and Prevention, 1 out of every 4 older adults falls at least once each year. Falls are also one of the leading causes of serious injury, loss of independence, and long hospital stays in adults over 65. And what is frightening is that many of those falls begin with something very small, standing up too quickly when blood pressure is lower than the body needs. The most dangerous part of blood pressure that is too low is that many people do not realize they have a problem. They do not have chest pain. They are not struggling to breathe. Nothing feels serious enough to sound an alarm. It is just a few small signs that happen over and over again until they start believing it is simply part of getting older. Some people feel dizzy for a few seconds when they stand up from a chair. Others have to hold onto a table or the side of the bed every morning before taking their first step. Some notice that their mind feels slower, they have more trouble concentrating, or they are forgetting things more often. Many feel extremely tired in the afternoon and no longer have the energy to walk, garden, or see friends the way they used to. Another very common sign is that brief moment when your vision goes dark after changing positions too quickly. You get up from the couch, off the toilet, or away from the dinner table, and suddenly everything looks blurry or dim. Sometimes it lasts only 2 or 3 seconds. Sometimes you have to stand still for a moment before you feel normal again. Many people think it is just from poor sleep, stress, exhaustion, or age, but in reality, it may be a sign that your brain is not getting enough blood because your blood pressure dropped too quickly. Some people also notice that their legs feel weaker than usual, even though they are not in pain. They walk more slowly. They avoid stairs. After just a few minutes, they want to sit down and rest. They may even stop going out alone because they are afraid the dizziness could happen unexpectedly. Dizziness, unusual fatigue, balance problems, or blurry vision when standing up can all be signs of orthostatic hypotension in older adults. This happens when blood pressure drops sharply after standing, reducing blood flow to the brain during those first few seconds. The important thing is not to tell yourself, "I'm just getting older." Age may slow the body down, but it should not leave you feeling dizzy all the time, unsteady on your feet, or constantly worried that you might fall. So, what blood pressure range is actually right as you get older? This is where many people get confused. They hear someone say that 120/80 is the gold standard, and then they try to force themselves to reach that number no matter what. But the truth is that not every body needs the same target. For many healthy adults between 60 and 74 who still walk well, drive, cook for themselves, and have few health problems, a systolic blood pressure between 130 and 140 is often considered reasonable. It is low enough to reduce the risk of stroke and heart disease, but still high enough to keep a steady flow of blood going to the brain and kidneys. After age 75, many experts believe that a range between 135 and 145 is more realistic for most older adults. At that age, arteries are stiffer, blood pressure regulation is slower, and the risk of falling becomes much higher. According to the American Heart Association and many studies in older adults, lowering blood pressure too much after age 75 may increase the risk of dizziness, falls, kidney problems, and hospitalization, especially in people who are taking several medications at the same time. For adults over 85 or those who are frail, walk slowly, have fallen before, or have health conditions like kidney disease, memory loss, or heart problems, the ideal blood pressure may need to be even higher. In many cases, a systolic pressure between 140 and 150 may be safer than trying to stay below 130. And it is not just the top number that matters. The bottom number matters too. Many people see a reading like 128 over 58 and think it looks good because the top number is not too high. But if the bottom number stays below 60 for long periods of time, the heart and brain may not get enough blood, especially at night or when standing up too quickly. A study published in JAMA Internal Medicine found that in adults over 75, people with a systolic blood pressure between 130 and 140 often had better survival rates than those whose systolic pressure was below 120. On the other hand, people with blood pressure that was too low had a higher risk of serious falls and loss of function. That does not mean you should let your blood pressure stay too high. Blood pressure above 150 over a long period of time still increases the risk of stroke, heart attack, and heart failure. The key is to find the safe zone that fits your body. Because as you get older, the goal is not to have the most perfect number on the monitor. The goal is to have enough energy to walk steadily, think clearly, and stay independent for as long as possible. There is a very simple test you can do at home in less than 5 minutes, and it may help you spot a fall risk before something serious happens. The unfortunate part is that many people have never been taught how to do this test. Even many clinics only check blood pressure while you are sitting still in a chair. But the real problem often shows up when you stand up. First, lie down on a bed or couch for about 5 minutes. Do not talk. Do not walk around. Just rest quietly so your body can settle. Then, check your blood pressure while you are still lying down and write down both numbers. Next, stand up and check it again within the first 30 seconds. Do not wait a few minutes before measuring, because the most dangerous drop often happens right when your body moves from lying down to standing up. If your systolic blood pressure, the top number, drops by more than 20 points, or your diastolic blood pressure, the bottom number, drops by more than 10 points, that may be a sign of orthostatic hypotension. For example, while lying down, your blood pressure may be 132 over 78, but when you stand up, it drops to 108 over 64. At first glance, you may still think that number does not look too low, but for the brain, that sudden drop can reduce blood flow during those first few seconds. That is when you may feel lightheaded, your vision may go dark, your legs may feel weaker, or you may have to stand still for a few moments before you can keep walking. Orthostatic hypotension is one of the most common reasons older adults feel dizzy, faint, or fall after changing positions too quickly. If you notice a major drop in your blood pressure when you stand up, or if you often feel lightheaded, do not stop taking your medication on your own. The important thing is to bring those numbers to your doctor. Sometimes simply changing when you take your medication, lowering the dose, or switching to a better option can make a big difference. You should also try this test at different times of the day, especially early in the morning or after taking your blood pressure medication. Those are often the times when blood pressure drops the most without people realizing it. Margaret and Helen are both 82 years old. They both had a blood pressure reading of around 148 over 86 at their last checkup. But that is where the similarities end. Margaret lives in Arizona. She still drives herself, shops for groceries on her own, walks for about 30 minutes a day, and plays golf with friends on the weekends. She sleeps well, rarely feels dizzy, and has never had a serious fall. Helen lives in Oregon. She has diabetes, mild kidney disease, and has fallen twice in the past year. Every time she gets up from a chair, she has to hold on to something for a few seconds because she feels lightheaded. She is also taking several medications for her heart, blood pressure, and blood sugar. If you only look at the number 148 over 86, many people would think they both need the same treatment goal. But that is not true. For Margaret, her doctor may want her blood pressure a little lower to reduce her long-term risk of stroke and heart disease. Because she is still active, physically strong, and at low risk of falling, her body may be able to tolerate lower blood pressure without many side effects. But for Helen, pushing her blood pressure too low could make things more dangerous. If her blood pressure drops to 120/70 but leaves her feeling dizzy, exhausted, and unsteady on her feet, the price may be too high. Blood pressure treatment in older adults should be based on overall health, mobility, medical conditions, and fall risk, not just one fixed number. Someone who still walks quickly, drives, and lives independently can often aim for a lower blood pressure target. But for someone who is already frail, has fallen before, or has several medical conditions, the top priority may not be lowering blood pressure even more. It may be keeping them alert, steady, and strong enough to stay independent. That is why two people of the same age with the exact same blood pressure reading may need two completely different treatment plans. The good news is that you do not have to wait until your next doctor's appointment to start protecting yourself. There are a few simple things you can do starting today to better understand your blood pressure and lower your risk of falling. The first step is to buy a home blood pressure monitor if you do not already have one. It does not need to be expensive. The important thing is that it is easy to use, has a clear display, and comes with a cuff that fits your arm properly. Then check your blood pressure twice a day for 7 to 14 days. Once in the morning before eating or taking medication. Once in the evening when your body is more relaxed. Write down both numbers every time you measure. But do not just track your blood pressure. Track how you feel too. Do you get dizzy when you stand up? Do your legs feel weaker than usual? Do you feel more tired after taking your medication? Are there times when you have to hold on to a chair or wall to keep your balance? Sometimes those small details are exactly what helps a doctor understand what is really happening in your body. For example, if your blood pressure is around 118/68 every morning, but you always feel dizzy when you get out of bed, that is an important sign. Or if every afternoon you feel sleepy, your legs feel heavy, and you no longer have the energy to go for a walk after taking your blood pressure medication, that is worth writing down too. Tracking blood pressure at home over several days often gives a more accurate picture than relying on a few readings in a doctor's office. It helps doctors see how your blood pressure truly changes throughout the day. When you go to your appointment, do not just say, "My blood pressure is fine," or "I feel a little tired." Bring a notebook with your readings and symptoms. You can ask your doctor very specific questions like, "What blood pressure target makes sense for my age and health? Could my current medication be lowering my blood pressure too much? Should I be checking my blood pressure when I stand up? Is there a medication I could reduce if I keep feeling dizzy?" Those questions may completely change the way your doctor looks at your situation, because as you get older, the goal is not to have a perfect number on paper. The goal is to have enough strength to stand up, walk safely, keep your balance, and continue living your life with confidence. After age 70, the goal is no longer to get your blood pressure as low as possible. The goal is to find a level that is low enough to protect your heart, but still high enough to help you stand up without dizziness, walk without fear of falling, and stay independent for as long as possible. Many older adults believe that feeling tired, lightheaded, slower on their feet, or needing to hold on to something when standing up is just a normal part of aging. But sometimes that is your body's way of telling you that your blood pressure may be lower than it truly needs to be. The important thing is that you do not have to accept living that way. By understanding your blood pressure better, paying closer attention to your body, and asking the right questions, you may be able to avoid a serious fall, a hospital stay, or a major change in your life. Over the next 7 days, I want you to try something simple. Check your blood pressure every morning and every evening. Write down the numbers. Write down how you feel too. Are you dizzy? Do you feel more tired after taking your medication? Do your legs feel weak? Do you feel unsteady when you walk? After 7 days, look back at everything you wrote down. Your body may be sending you a message that you never noticed before. If you are going to start this challenge today, leave a comment saying, I'm starting today, so I know you are serious about protecting your health. And if you have parents, relatives, or friends over 70, send this video to them. Because sometimes the right information at the right moment can help someone avoid a fall that changes their entire life. If you found this helpful, make sure to like this video and subscribe to the channel so you do not miss future videos about health, blood pressure, and how to stay stronger as you get older.